Hello friends. In this video first, COVID vaccine will be administered in safe and appropriate places, assures Walgreens executive. Second, Health Commissioner, Fed sending more COVID vaccine but supply still the issue. Friends, go to the channel link in the description. And a donation for a good announcer link under the video. And we start. COVID vaccine will be administered in safe and appropriate places, assures Walgreens executive. Rick Gates, Senior Vice President of Pharmacy and Healthcare at Walgreens, assured CNBC that the company will safely and efficiently administer COVID vaccines. "We'll make sure our healthcare professionals are there to give them the vaccine and monitor them appropriately," Gates said Tuesday evening on The News with Shepard Smith. "No, it's not going to be out in parking lots, you'll see it in our stores, but we'll make sure we'll have safe and appropriate places to do the vaccinations." President Joe Biden's administration announced Tuesday that it will expand access to COVID vaccines and start distributing them directly to retail pharmacies next week. "It's all part of the administration's effort to make it faster and easier for Americans to get vaccinated." Gates told host Shepard Smith that Walgreens is currently supporting about 15 states and jurisdictions, which means the company will receive about 170,000 doses for the first part of the launch. White House COVID response coordinator Jeff Zients said the process will start out slow, with 6,500 pharmacies receiving 1 million doses. CVS and Walgreens alone will get deliveries across 20 states. Distribution will ultimately expand. Eventually, as we're able to increase supply, up to 40,000 pharmacies nationwide could provide COVID-19 vaccinations, Zients said Tuesday. According to a survey from Dynata, a leading first-party insights platform, nearly half of respondents would take the vaccine immediately once it became available. The push comes amid new urgency to get as many Americans vaccinated as possible to prevent the spread of potentially more serious strains of the virus. More than 95,000 Americans died from COVID in January alone, according to a CNBC analysis of Johns Hopkins data. April 2020 was the second highest month and 60,716 Americans died of the virus. Gates explained that the past few months have been a learning experience to help equip the company to deal with administering the COVID vaccine in the wake of criticism from New Jersey Gov. Phil Murphy blamed Walgreens for the Garden State's sluggish vaccine rollout during a January 20 interview on The News with Shepard Smith. "The big reason is the federal program with CVS and Walgreens," said Murphy. "They basically amass these doses, they schedule visits to long-term care nursing homes, extended living, and they're punching under their weight, particularly Walgreens, and that's where most of the yet-to-be-used doses are." Gates said that he knew it wouldn't run perfectly at the beginning, but that rollout for long-term care facilities has accelerated. "What we saw was a ramp-up of that has continued pretty religiously since that point," said Gates. "We vaccinated about 1 million long-term care residents in the first month and about 1 million in the last week alone, so you have seen a significant ramp-up in what we're doing." Health Commissioner, Fed sending more COVID vaccine but supply still the issue. Tennessee got an incremental shot in the arm this week in the fight against COVID-19 when the federal government upped its allocation of first doses of vaccine by 16%. The state is getting 93,000 combined doses of Moderna and Pfizer vaccine this week and for the following 2 weeks, Health Commissioner Dr. Lisa Piercy said during a media update Tuesday. That's up from the 80,000 Tennessee had received over several prior weeks. Piercy, who also offered a positive report on trends in new cases and hospitalizations, said the supply uptick was one reason the state broadened its vaccine eligibility to include people between the ages of 70 and 75 Tuesday. Piercy explained why the state still hasn't opened up to 65 and over populations as a whole, as some states have done. She said data show a significantly higher risk of hospitalization and death, 40% and 70%, respectively, among 70 to 75-year-olds compared to 65 to 69-year-olds. While we are excited that we have increased supply week over week, it's still very much in low supply and not anywhere close to meeting the demand, Piercy said. She acknowledged seeing hopeful signs that the government might up the supply again in late February, but said it still remained likely that teachers and people over 65 are at least several weeks from becoming eligible. We do project that if supply remains the same, it will take us most of the month of February to get through the 70+ population, Piercy said. We will certainly open that up sooner if we get additional vaccine. Those with chronic underlying conditions, the so-called 1C group, may have to wait until well into March or even April unless supply takes off. Piercy said a 2/3 drop in cases over the past 6 weeks since the peak in late December has been followed by a 55% decrease in hospitalizations since the state saw those peak January 6. She said the trends appear to be sustained. This is a very dramatic decline that we're very encouraged by, Piercy said. I've talked to several hospital executives and they're finally feeling some breathing room, which is good, and we want that to continue. Piercy attributed much of the decline to Tennesseans' behavior in terms of social distancing, mask wearing and avoiding close gatherings. I don't want people to get into the thought that vaccine is the only way to protect themselves, Piercy said. It is the best way to protect oneself, but in the meantime let's not forget about all of those very important measures that we've been taking all along, because they're working. As of Tuesday, about 1 in 7 hospital patients had COVID. Piercy said that was down from about a third of patients in late December. ICU percentages are 28% COVID, down from more than 50% about a month ago. Piercy addressed continued elevated death trends, saying that does not necessarily signal that anything bad or unexpected is going on. She said the cadence of fatal COVID cases usually takes another week or two after people enter ICU for those that don't survive to die. Then there is another week to sometimes up to 3 weeks to process the death certificate and then get it into the state system. Piercy said the state expects that to start trending downward in the next week or two. We're keeping an eye on that, but so far we've not seen anything to indicate otherwise. With close to 40% of deaths occurring in long-term care outbreaks, vaccinations have been a high priority. Those are handled through a federal partnership with pharmacies, but Piercy reported that nursing home and skilled nursing facilities are 100% complete with first doses. Assisted living facilities, which typically have less vulnerable residents, are just a few days from completing first doses. Then it'll start all over again and they'll go with second doses, but that's something we're very excited about, to have a fully vaccinated and protected long-term care population, because we know those individuals are at very high risk, Piercy said. Asked about the lower profile role hospital systems have played recently, Piercy said the main cause is lack of supply, which has also decreased her department's reliance on the Tennessee National Guard. We are in the works of getting more guardsmen on orders and into our facilities and to support in our community, but the rate-limiting step remains supply. There's a lot of talk nationally about large, federal government mass vaccination sites. For us here in Tennessee, I'm not sure that would really be additional assistance to us. We've got capacity, we just need the supply in order to it. That's a major reason hospital systems have stepped back for the time being, Piercy said. She said the state had a planned transition to health departments and pharmacies, but the Tennessee Department of Health welcomed continued hospital participation so long as systems made their sites accessible and equitable to all patients regardless of ability to pay or any prior connection to that system. They continue to be very interested in providing vaccine to their community, and that's exactly what I would expect, because that's where the public goes and trusts those healthcare providers, and so we're happy for them to help. But Piercy said without a bump up in supply, standing up their own sites doesn't make a lot of operational sense for hospital systems. While supply is still quite low, it's really kind of inefficient to set up a large community site when you only have a few hundred vaccines per week, she said. I do think we'll continue to see hospitals stay online or come online as supply ramps up. Ballad Health CEO Alan Levine told News Channel 11 late Tuesday afternoon that Ballad closed its Tennessee community sites a little less than 2 weeks ago precisely because of supply issues. We were pleased to be able to offer it up, Levine said. We've done over 25,000 vaccinations and we'd love to be doing them now, but we understand, the state only can do so much based on what supply they get. In Sullivan County 2 weeks ago they got 1,200 doses, so dividing that among 3 different locations would have made it inefficient, Levine said. So rather than replicate those assets, we instead threw in and redeployed our people to the Bristol Motor Speedway to help the Department of Health. At the end of the day, everybody's goal is to get as much vaccine out as possible, and whatever we can do to help the Department of Health do that, we're prepared to do it, and we'll do it enthusiastically. Levine said certain levers would have to trip for it to make sense for Ballard to stand back up its community sites. The first would be, is there a large enough supply and is it reliable enough, he said. Number 2, if the good news is there's enough vaccine, the bad news is, the health department, are getting overwhelmed at their locations. At that point maybe it makes sense to reopen ours and take the pressure off. That's one of those things, you know it when you see it, and we'll take guidance from the Department of Health, but the minute they say they want us to do it, we will absolutely stand our sights back up again. Piercy said she didn't want to get overly optimistic, but that some signs seem to point toward additional supply increases in the not-too-distant future. I am encouraged that seems to be moving in the right direction and really looking forward to getting a third candidate, the Johnson & Johnson vaccine, in the vaccine cycle, which will help accelerate our efforts. Thank you for attention. Go to the channel link in the description. Also help for a good announcer link in the description.